I'm Rennie Waldron, and I practice neurology and neurosurgery here at Upstate. I see dogs and cats for disorders of the brain and the spinal cord and the peripheral nervous system. I love neuro because it's this great combination of treating both medical conditions and being able to do surgery. So I get to improve the quality of life of all of my patients by doing things like treating their seizures, getting their seizures under control, or treating their meningitis with medications and helping them get their normal personality back. And then I also get to do spinal cord surgery and help dogs walk again and alleviate their pain. So Sadie came in to us after being hit by a car. And the day she came in, she was in very critical condition.
When we first brought her in, I was almost really expecting the worst. She looked really bad. And Dr. Adley was the first to see her here.
She was basically unresponsive, couldn't stand, didn't know where she was, couldn't move. And so obviously her parents were devastated as to what was going on and what was going to happen over the next few days.
She had a variety of signs of both brain trauma and spinal cord trauma.
But they just needed a little bit of hope.
Basically, when we brought her home after about 8 days on that Friday, she couldn't walk, she couldn't eat on her own, she couldn't drink on her own, she couldn't stand, she couldn't support herself.
So it's taken her quite a while to really even be able to stand up. Was amazing for us. I mean, it was just
Part of
the first time she walked, we were just like proud parents, like your child walking for the first time.
In Sadie's case, we were most concerned, based on her neuro exam, about her brainstem and the spinal cord in her neck. So because we were most interested in soft tissue rather than true bone, we started with MRI. And what we found there were essentially bruising type injuries that were fairly severe in her brainstem and in the spinal cord in her neck. And so once we were able to rule out that she did not need any surgery, we knew that with time and really intensive supportive care and really dedicated owners and physical therapy that she had a good chance of walking again.
Had we ignored what Dr. Waldron told us was necessary to get Sadie back to where she needed to be, had we not done the exercises that she told us, I don't think Sadie would be where she is.
They were so dedicated every day to her getting up and walking again. So without that, I don't think that she would be walking around here, wagging her tail and being pain-free.
Now when she comes, she's making her social rounds. She goes to see all the doctors and all the technicians and all the people, and they're all asking about her.
She's going to physical therapy. She's dancing for her treats. She's able to wag her tail and shimmy and not fall down. She's coming back, and we're extremely thankful to have our little girl back.